Now, the idea of the divide that we mentioned last week gets us back to a larger problem that has existed in the world of digital methods, is the world of health. Because having access to digital data as it is parsed, as it is accessible, as it is used by a variety of fields is becoming even more pressing in the world of medical applications, because the world of medical application requires enormous amounts of data, enormous amounts of records that are much more easily used and applied using machines. And of course, here, the idea of the digital divide means that some people might have better access to health if they have better access to digital methods, just as much as the healthcare providers would be able to provide a higher level of care if they have higher access to those methods. And in that case, that means certainly that there has been a push pretty much across the board for medical practitioners to focus on how those digital tools could be used to both improve the lives of patients and also improve the amount of work that they can provide. In that case, that means a whole lot of better efficiencies, better safety, better ability to diagnose, avoiding a lot um, of mental health issues, and of course, just improving the overall relationship that people might have with their healthcare providers. And the larger context for that is one of legal issues, of course, whether that data can be kept as private as possible, whether it is going to be interpreted in the ways that need to be interpreted, and whether or not those things can be used um, for for context that were not necessarily intended when somebody signs a waiver or signs an authorization for their data. And that is something else we have mentioned previously in this class relating to privacy, of course. Now, most of the time, we tend to trust our healthcare providers to keep our information safe, but we also know that we are in a world that is increasingly allowing for not so clear data sharing across borders. And, as businesses go out of business, as companies use new providers all the time, there are some very blurred lines that could happen here. And of course, for the domain of health, that also means kind of changing their own practices as well. As this point out here, IT experts for technical issues such as data safety, because it is not something that your average healthcare provider is trained with. And this is something that has been, across the board also for all domains of work. Anybody that uses computers will have to have this IT element to their life, and usually the IT element is outsourced, unfortunately, or I don't know. Maybe that's a bit of a value judgment here, but that IT element is outsourced, meaning that somebody else is able to access the data. That means that perhaps the data is stored in another country, for example, and of course that leads to another set of legal issues. In and of itself, the fact that people are using technology for medical applications also has not so great of a background. For example, with this test of electroconvulsive therapy or electroshock therapy or shock treatment, as it was called back in the day. Now, using the new technology of electricity was supposed to have all kinds of health benefits. In this case, longer life for people past 40, they say. Having the possibility of using shock treatment for mental illness, as is mentioned here, which would include depression, schizophrenia, pretty wide range of mental health issues, not something particularly targeted because it was very much in experimental. The use of this new technology was seen as a very veritable a revolution for the practice of medicine, and especially for those more confusing parts of medicine at that point, which is the brain. Perhaps interesting at some point is that previous to using electroshock therapy, it was common to use insulin to treat mental health issues because it was kind of seen as a wonder drug for a while. So the word of using shock therapy was extensively tested for years and years. In fact, so much so that the idea of it being an experimental idea. So again, right, being hooked onto essentially a battery that would provide more or less high voltage shocks directly to your body or to your brain. This became tested pretty extensively. Longhi was asked to study cardiazol therapy, Cornero was to investigate insulin shock therapy, and Benny was assigned to a special research program for which Cerletti defined the basic goals. We have seen that by discharging an electric current of 90 to 100 volts, under 20 volts for fractions of a second on dogs, we can provoke a kind of epileptic fit. We must improve the circuit and make it as safe as possible so that we can eventually try this on humans. If we succeed, it is possible that this treatment will be more efficacious than cardiazol shock therapy. But about half the dogs died of cardiac arrest because of the placement of the electrodes. Binney tested various circuits and observed that when the two electrodes were placed on the dog's cranium, one on each temple, epileptic fits were consistently induced and the animals survived. Every week during 1936 to 1937, the dog catcher's truck stopped in front of the clinic and unloaded dogs. Binney, using electroshock, and Cornero, using insulin, studied the effects of these treatments on brain structures. It was necessary to perform postmortem autopsies rapidly to separate the direct effects of treatment from postmortem alterations which might have invalidated their results. Every day, Benny, Felici, and Cornero carefully studied brain specimens and exchanged ideas and observations late into the night. Cerletti frequently came by to check the material they had collected. Now, this longer life, promise of a longer life from the people past 40 also means that people would have the possibility to, of course, be more economically stable. And as it is mentioned here, people would have a better overall mental health, including for what they call here melancholia. Melancholia is one of the commonest form of nervous breakdown, which will cause 1 out of 17 Americans now living to spend some time in a hospital as a mental patient. It is most likely to strike women of 45 to 60 and men of 55 to 65. And so this is marketed by an insurance company that would allow you to, of course, become healthier using these electroshocks, apparently. And the idea itself does not happen for the first time in the 20th century. It was tested as early as the 18th century by the people who were trying to begin the use of electricity for all kinds of applications. And of course, it was tested on animals as well. And how it was tested and how it was used was most specifically in a local space, right? It was based on whether you can affect the kidneys or the spinal column or the brain, and hopefully that direct control, that direct effect of electricity would affect the results that people needed. Now, it's important also to note that melancholia itself is a very wide disease, or it's a very wide condition, I guess, as it was recognized up until very recently. So this is from the DSM-4. So DSM is the manual that is used for psychologists or psychiatry, I suppose, in our context. Stands for Diagnostic and Statistical Manual of Mental Disorders. So the book is used by mental health professionals to identify certain conditions, and the DSM-4 described melancholia as either of the following occurring during the most severe period of the current episode: a loss of pleasure in all or almost all activities, a lack of reactivity to usually pleasurable stimuli, does not feel much better even temporarily when something good happens, Three or more of the following: a distinct quality of depressed mood. Depressed mood is experienced as distinctly different from the kind of feeling experienced after the death of a loved one. Depression regularly worse in the morning, early morning awakening, at least 2 hours before usual time of awakening. Marked psychomotor retardation or agitation. Significant anorexia or weight loss, excessive or inappropriate guilt. Pretty wide range of symptoms, of course, and not sure how any of you live your lives on a day-to-day basis, but these are obviously more or less common ways that people experience life as a whole. And in the previous slide, as they were telling us, 1 in 17 Americans would be hospitalized for this, and how many of them had to be treated with this newfangled technology of electric shock to improve that temporary loss of pleasure, or the temporary lack of pleasurable stimuli when something good happens. You know, so the applications of technology combined with the knowledge that is available, and the knowledge that is available according to the best of our science here, can turn into be a pretty disastrous situation. Now, it doesn't have to be this way, of course, and in some places and in some ways, electric shock therapy has been used, and in fact, to this day, still being used. However, basic of a system it might look like. So understanding exactly how we are getting into using specific tools, and they're understanding exactly how this is being used for medical purposes, is obviously of a very great import to a lot of people.